Hi everyone, welcome back to my YouTube channel, and today we are going to talk about temporal bone. So let's start our topic with introduction. Temporal bones are pair of irregular cranial bones that are located at the sides and base of the skull near the ears. They play a crucial role in protecting the brain, housing the organs of hearing and balance, and forming part of cranial base. The temporal bone is one of the most complex bones in the skull as it contains multiple parts with important anatomical structures. Location and structure of temporal bone. It is found at the lower lateral sides of the skull. Each temporal bone contributes to the cranial floor and side walls of skull. They articulate with parietal bone, occipital bone, sphenoid bone, and zygomatic bones, as well as with the mandible at the temporomandibular joint. Parts of temporal bone. Temporal bone has four main parts, each with distinct features and functions. First is squamous part, second is mastoid part, third is petrous part, and fourth is tympanic part. Now let's talk about these parts of temporal bone one by one. First part is squamous part, that is a flat, thin portion that forms the side of the skull. It contains zygomatic process which extend forward to join the zygomatic bone and form the zygomatic arch, that is cheekbone. Second part of temporal bone is mastoid part. It is located posterior and inferior to the ear canal. It contains the mastoid process, that is a bony projection that provides attachment for the muscles. Inside there are mastoid ear cells which communicate with the middle ear and help regulate ear pressure. Next part of temporal bone is petrous part. It is thickest portion of temporal bone that is wedged between sphenoid and occipital bones. It houses the cochlea and semicircular canals that are organs of hearing and balance. They contain important openings such as internal acoustic meatus through which facial and vestibulocochlear nerve passes. Next part of temporal bone is tympanic part that surrounds the external opening of the ear. It forms part of external acoustic meatus, that is ear canal. It provides protection for structure of middle ear. Important features of temporal bones. First is styloid process, that is a slender pointed projection that is below the ear. It serves as an attachment point for muscles of tongue and pharynx. Second feature of temporal bone is mastoid process, that is large rounded projection behind the ear. It provides attachment for sternocleidomastoid muscle. Third feature is external auditory meatus, that is opening that lead to ear canal. Fourth feature is mandibular fossa, that is a depression that articulates with the mandible, forming the temporomandibular joint. Functions of temporal bone. First function is protection, as this bone safeguards the brain and delicate structures of the ear. Second function is hearing and balance, as this bone houses the middle and inner ear, including cochlea and semicircular canal. Third function is muscle attachment, as this bone provides points for muscles of mastication, neck, and tongue. Fourth function is articulation, as these bones form the temporomandibular joint with the mandible, thus enable chewing and speaking movement. Fifth function is spatial structure, as this bone contributes to zygomatic arch and side contour of the skull. Conclusion of this lecture video. Temporal bone is a paired cranial bone with a highly complex structure consisting of squamous part, mastoid part, petrous part, and tympanic parts. It plays a dual role in protection and function, thus safeguarding the brain, enabling hearing and balance, and forming joints and attachment sites for the muscles. Its anatomical importance make it one of the most significant bones of the skull. And this was all about temporal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.